Hi, my name is Dr. Charles Durr, and I want to talk to you today about carpal tunnel syndrome, arm pain. Okay, now carpal tunnel syndrome is literally a compression of the median nerve as it flows through the carpal tunnel, and frequently it's misdiagnosed. Any kind of wrist pain, numbness, tingling in the hand, what have you, is just jumped. Scratch that, start over. Hi, my name is Dr. Charles Durr, and I want to talk to you today about carpal tunnel syndrome. Now, carpal tunnel syndrome is one of the most misdiagnosed and overused explanations for a disorder within the lower extremity, the upper extremity. Now, carpal tunnel literally is a compression of the median nerve as it passes through the carpal tunnel, compressing that nerve, causing wasting in the outer part of the hand and numbness and weakness in the outer part of the fingers. Carpal tunnel syndrome is not pain in the wrist, it is not numbness of the thumb or forefinger, but frequently any disorder in the hand is kind of lumped up in that diagnosis. So carpal tunnel syndrome is literally a compression of the median nerve as it passes through there. Now frequently many people have numbness, tingling, weakness in the lower extremity that is not directly caused by compression syndrome in the carpal tunnel. So you have to be looking for a multifactorial cause of the problem, and frequently it starts with a problem in the neck. The holes that are in the spine, right here at the 5th, 6th, and 7th cervical level, those nerves exit out and form what's called a brachial plexus. The brachial plexus then goes down into the lower extremity, lower part of the arm, and there is the actual median nerve at its carpal tunnel there. But you have a radial nerve and an ulnar nerve. So there can be compression at the wrist, there can be compression at the elbow, there can be compression at the shoulder, or most likely compression in the neck. Now also the muscle can be caught up in a muscle, the nerve can be caught up in a muscle in the forearm, the bicep, the armpit. So you have to look at all potential causes. So an old wise professor of mine once told me that if you're stepping on a dog's tail, it will bark out the mouth. And that most aptly applies to frequently wrist pain, numbness, and so forth. So if there's a compression in the neck, whether it be a bulged or herniated disc, or a lack of nerve hole at the IVF or where the spinal cord nerve exits, is most likely the number one cause. Then we look at the elbow, the forearm, and then the carpal tunnel itself. And carpal tunnel surgeries are unfortunately extremely ineffective because they're only looking where the dog is barking, so to speak, and they're not looking at the neck, the shoulder, forearm, elbow, and so forth. So our approach is to do a thorough x-ray of the spine, particularly the neck, MRI if necessary to diagnose compression syndrome from a bulged or herniated disc. We will do an adverse neural tension exam. So we'll actually put the arm in different positions to see if we elicit a response from the particular nerve. And from there we can diagnose where the adhesion points most likely are. And from there the best treatment for carpal tunnel syndrome is decompression therapy for the cervical spine to shrink any bulged or herniated discs in the neck, realign the spine, reestablish the proper alignment so that the nerve holes as the nerves leave the spine are as open as possible. And then free up any adhesions along the path of the nerve and give specialized stretches and rehab exercises and so forth. But carpal tunnel syndrome is frequently truly only caused by compression in the wrist. It isn't caused by anything in particular. And it's frequently for people who type and have their wrists in an extended position for any length of time. But when we see a person who has wrist pain, numbness, tingling in the lower extremity, the first place we look is the neck. We look for a postural alignment, and frequently they have a forward head translation or a head tilt or a head shift of some sort that is either stretching or compressing the nerve. An MRI would reveal if that, in fact, they had a bulged or herniated disc in that area compressing the nerve. Again, we check for the adverse neural adhesions in that extremity. And then we look at the reflexes and the sensations, and we check the carpal tunnel and so forth. But if we find the compression syndromes and the adverse neural tension signs, then we recommend appropriate treatments. So a compression syndrome in the neck, that would be causing compression of the lower nerves of the arm would be decompression therapy, and extremely effective way to help treat those bulged or herniated discs. In addition, we recommend oxygen therapy. Now, oxygen therapy is delivered during decompression, and what happens is when you're decompressing the spine, you'll be breathing concentrated oxygen, and what that does is increase your tissue saturation of oxygen. So when you're in a decompressive state, we increase saturation of oxygen to the spinal cord, the nerves, and the discs in that area. So we'll actually increase oxygenation. And what causes numbness, tingling, burning, weakness is a lack of oxygen or a lack of glucose in the nerve. So if your nerve is being squeezed, it's being stretched, or some other metabolic problem like diabetes or something along those lines, you're not getting oxygen, you're not getting glucose. So if we can free up the nerve, increase oxygenation, take away compression syndromes, and then give some rehabilitative stretches and postural corrective exercises, we can remedy numbness and tingling, carpal tunnel syndromes very easily. So if you're interested in being checked or learning more or even discussing it personally with me, please call the number on this website. I'd be happy to discuss the potential for you in this office. Thank you.